With the focus of ending AIDS by 2030 by accelerating interventions, raising awareness, and engaging communities in HIV prevention efforts, new HIV infections stand at 38,000 with 20,000 deaths. Approximately 1.3 million people living with HIV are virally suppressed, and new HIV infections and related deaths have reduced according to reports from the Uganda AIDS Commission. This was addressed today at Uganda Media Center by Uganda AIDS Commission.
Thank you very much.
Despite the reduction in numbers, as of 2023, 40% of new HIV infections were found amongst adolescent girls and younger women aged 15 to 24 years, 4 times higher than their male counterparts in this group. It was also stated that 25% of the new HIV infections are acquired through pregnancy.
However, unfortunately, we always have a however added to whatever we say. We note that we still have a high burden of new HIV infections among adolescent girls and young women aged 15 and 24, as you heard Mr. Magala say. In this group, HIV prevalence is 4 times higher than that of their male counterparts. We are also still seeing many babies. In 2023, about 4,700 babies were born with HIV. Yet, we have drugs in the health centers that an HIV-positive mother can take to enable her to deliver an HIV-negative baby.
The chairperson of the Uganda AIDS Commission highlighted several achievements in place to reduce the burden of HIV, including significant progress in the elimination of mother-to-child transmission of HIV and efforts to engage men in HIV prevention, among other key initiatives.
Accelerate and implement the test and treat and attainment of the fast-track targets of what we call 95, 95, 95 by 2025. That means that 95% of all people who are HIV positive would have been identified through HIV testing. It would also mean that 95% of all who test positive are enrolled on treatment, as we develop a roadmap to ensure that there is continuity to improve impact, effectiveness, and long-term resilience, given the investments that have been made in the HIV program.
With the government aiming to ending AIDS by 2030, different strategies were put in place to ensure that HIV infections are curbed by 2030 under the theme Accelerating Interventions to End AIDS as a Public Health Threat.
One of the things we must do is to aggressively address HIV stigma and discrimination at all levels. The self-stigma, the family level stigma, community level, which includes workplace stigma, health services stigma, and also widely at country level. On increasing HIV/AIDS funding, we have already referred to this because the national HIV response is costly and remains predominantly donor funded, especially funding for treatment, for condoms, for testing kits. The government spends about 700,000 each year to treat one person living with HIV.
Henry Magara, the country director of the AIDS Health Care Foundation, urged the youth to advocate for sexual and reproductive health, as well as for policies and guidelines that promote preventive measures against the spread of HIV.
So advocacy will help, and we want to see the young people taking lead. Then the second last is the policies and guidelines that as a country have, discussed and looked at, but which have not been implemented to the final details. We have the National School Health Policy, which has not been pronounced as a policy that has to be implemented in schools. So young people need to come out and say, we need that policy.
The public has been urged to join the nation in commemorating World AIDS Day and stand together in the fight to end HIV. The event will take place on 1st December 2024 at Bukungu Primary School in the Buyende district and will be presided over by His Excellency Yoweri Kaguta Museveni.